Well, welcome back, everybody, to the Oregon, Washington, Alaska virtual conference. If you were with us on our first session, you've seen that we attempted to show a video, so we're going to try to show that video again. Each year, a lot of our past presidents get together, they reunite, talk about all the good times with HFMA. Due to COVID this year, our past presidents were not able to have our dinner for them. So they got together and have sent a message to a lot of our members and wanted us to play this during the conference. So we are going to attempt to show you their video they've created for all of the Oregon members.
Hello, Oregon HFMA brothers and sisters.
Hello, Oregon HFMA brothers and sisters.
Brothers and sisters.
Brothers and sisters.
Each year, your chapter past presidents
come together at our annual dinner
We share stories and best practices.
show love.
Sing your praises.
And oh my, there is no better chapter in the whole
Oh my, there's no better chapter in the whole association.
Without physical meetings this year,
we're coming to you now in a video
To thank you for being the rock in these trying times.
It's a big challenge to bring our members virtual education,
Networking,
sponsor stewardship.
Even interactive question and answer sessions.
So how do we push forward? Together.
together.
trust the body of work that you have built.
Lean on one another like you're each all you've got, all you've ever got.
all you've got.
Current officers,
Board members,
Chairs and co-chairs.
volunteers,
members,
sponsors.
You all flavor the Oregon HFMA secret sauce.
Your past presidents believe in you.
And know that you all will do what is right.
When your feet meet the streets.
I've got a feeling that we're all going to be all right. Before you know it, we'll be back to normal again.
Stay safe, everybody.
Stay safe.
Stay safe, everyone.
Stay safe, everyone.
I miss you all.
And I miss you all. Take care.
And by the way, thanks for being the heroes.
Everybody.
Rock your
Body,
Everybody.
rock your
body,
Right.
back streets. Back.
All right.
Oh my
God.
Work back again.
brothers,
Sisters.
Everybody.
Sing.
We're gonna bring some
Flavor.
Show
You
I've got a
question
for you
better
answers.
Now.
Well, that's very fun. So a message from all of our past presidents. This session sponsors is Triage Consulting Group. So Triage is the nation's leading hospital revenue consultancy with offices in San Francisco and Atlanta. They're dedicated and energetic team of over 500 talented and educational professions work across the United States. Since their inception, Triage has identified and recovered $4 billion in lost revenue for some 700 hospital clinics. They offer sophisticated and comprehensive payment review and recovery services that go beyond the capabilities of most firms. They offer risk minimization training, consulting tailored to the client needs. Triage staff is expertly trained in all aspects of hospital reimbursement. They provide their clients with education and recommendations to future losses. Thank you, Triage, for your ongoing support in the Oregon chapter and Washington, Alaska chapter. So this session is the future of healthcare workforce in the intelligent age. Our speakers are Matt Kalina with Olive and Cindy Fry with Jefferson Health. So Cindy, a little bit about her. She's the Senior Vice President of Revenue with Jefferson Health, a regional academic health system. Cindy leads the revenue cycle area, which is designed to improve and achieve optimal net revenue. Cindy's formal SVP and Senior or Chief Revenue Officer of Trinity Health and a former Senior Manager in PricewaterhouseCoopers Healthcare Consulting Practice, and has excessive of 30 years of revenue cycle experience working with hospital and physician environments. Cindy specifies experience in strategic planning execution, receivables management turnaround, receivable cycle design, regulatory compliance, informational systems, and leadership training with team motivation. Cindy's a certified facilitator for the Myers-Briggs Personality Type Indicator, which provides insights to effectively harmonize people, systems, processes to promote greater efficiency and effectiveness. Cindy's an author, speaker, and instructor. She is a BS in Management with Rutgers University, an executive MBA from St. Joseph's University, and earned her PhD in Natural Health. She's an adjunct professor at St. Joseph University in Philadelphia, where she taught strategic management and healthcare organizations. In the MBA, Doctor of Osteopathic Medicine program in Leadership Development and Pharmaceutical Executive MBA program. Matt is currently the National Strategic Lead in Olive, a healthcare artificial intelligence company that is the market leader in developing and deploying AI workforce programs for hospitals and health systems. Matt is a solution and product enthusiast with a passion for disruptive emerging technology, artificial intelligence, machine learning, the future of work, and startups. With the focus in healthcare operations for over 5 years, Matt has developed AI programs alongside some of the nation's leading healthcare providers to drive overall business transformation and strategic growth. Please welcome both Matt and Cindy.
Thank you so much, Tammy. Really, really appreciate it. If we knew there was such a performance that was preceding us, we would have done a musical ourselves. So you're going to have to the boring slides today. But thank you so much for having us. We're really excited to be here. As Tammy had mentioned, I'm Matt Kalina. I'm National Strategy Lead at Olive, where we work with hospitals and health systems to build and implement an AI workforce to take on some of the tedious routinized work across the enterprise to maximize the capacity of their human staff, allowing them to focus on the things that their humans should be doing. I'm so pleased to be joined by Cindy Fry today. Cindy is someone that I've recently had a lot of an opportunity to get to know. We've had quite a few conversations about how the world around us is changing so quickly, whether that's current events, the global health crisis that we all find ourselves in, or technology, you name it. So while Cindy's going to take some time a little bit later in the presentation to talk about her background, introduce herself, and some of the things that her and her team are doing to transform the way that they're doing work at Jefferson, I'm going to take a few minutes to kind of walk us through the agenda and sort of set the stage for the dialogue in the first half of our 30 to 45 minutes together. So to kick this off, what we're going to do is kind of dive into the reality of today. 2020 hasn't been a very interesting year at all, but we're going to sort of frame that through the context of what that means for our industry and some of the staggering impacts that that's having. Then for the second piece, we'll kind of dive in a little bit into some of the advanced technologies that have had a lot of hype in the industry and some of the things that we can all do to turn some of these more advanced technologies science fiction or from science fiction into science function. So some tangible resources that you can all leave today with to help gain a better understanding to really embrace the technology in the changing environment that we're all finding ourselves in. There's a lot of materials that we have today that will be available to you all to take as a takeaway. We're not going to read through every single bullet that we have, but it's really meant to be a resource. And for the second half of our dialogue, I'm going to hand it over to Cindy to walk us through what she's doing within her organization and building and implementing the future of work at Jefferson Health. So if there's any questions as we go throughout this, feel free to drop them in the chat. We'll hopefully be ending a couple minutes early so that way we can address any questions that you all have. But I wanted to take some time really to frame everything that's going on around us. I guess at a high level, 2020 has definitely been an interesting year to start things out. I know that these headlines that we have here really aren't doing much justice. They're definitely an understatement to how this has impacted all of us, both personally and professionally. And it's really been quite an interesting time, but in interesting times like when we have chaos and utter confusion around us, there's oftentimes a lot of opportunity for us to do things differently or challenge the way that we've done them. So that's really what we're going to try to focus on today is taking this opportunity we have with the world around us changing so rapidly and forcing us to look at things a little bit differently. How can we use that to empower ourselves to come out of this even stronger than before, as was highlighted in the video that preceded our presentation? So just to kind of put this into a frame of reference for what it means for all of us, you know, in the healthcare industry. Being with a HFMA group, I'm sure the financial impact that this is having is not something that's lost on this audience, but it's really just staggering when you think about all of the impact that this is having to business operations across the entire industry. There's a lot of studies out there showing different projections that are changing every day with different waves of coronavirus that are impacting certain regions and certain areas. But, you know, it's staggering to think that the average month loss is about $20 billion within our industry. It's absolutely astounding. It's unprecedented. It's not like anything we've ever seen before. Then, you know, not even just the financial impact that this is having to the business operations within the institutions that we work within, there's a huge impact to the delivery of care that is instrumental to the communities that we serve. You know, delaying elective procedures and putting these off to handle some of the volumes that we're seeing from coronavirus is really impacting the access to care within our communities. It's presenting a lot of opportunities for us to embrace technology to advance the way that we deliver care, to make that more accessible to our network and the communities that we serve. And then also, finally, you know, not to be understated, is the human impact. This has really impacted a lot of folks professionally and personally. I'm sure all of us have had experiences or stories of friends, colleagues, or others that may have been impacted by things like furloughs and reductions, but also just the illness itself. I think there's a lot of stress that is being caused around this that is challenging all of us from many different avenues and really challenging us in ways that we haven't been challenged before. So with all of this crisis and all these things going on, there's a significant amount of opportunity that comes up with the refocusing of all of our resources on addressing some of the things that have been brought to light with the pandemic. We've actually started a global health awareness and risk monitoring and reporting. There's been a lot of investment in understanding the basics of epidemiology. There's a lot of access to global health dashboards and disease tracking that was not as public facing, but you know, we're based out of Ohio, and you know, every week we have an update with our governor on some of the things that are happening across our state, and that sort of ability to have visibility into some of the challenges from an epidemiology perspective were things that were not as mainstream before. And then also just a burgeoning awareness on comorbidities, underlying health conditions. It's really bringing healthcare to the top of the inbox, so to speak, as far as everyone's attention. Also, the adoption of new healthcare delivery models has been something a lot of folks have been looking at, and a lot of things that have been being pushed out across different states and local governments. There's greater personal scrutiny of healthcare service utilization. You know, there's a lot of testing and other things going on. How do we maximize our access to care using telehealth? How do we accelerate digital health services and applications to monitor the health and well-being of our communities? Also, there's a huge opportunity to look at the administrative spend. So when you look at the $3 trillion of cost that is in healthcare, about a third of that is related to administrative capacities. And I think just the sheer volume of work that has come in through testing and treatment of this global pandemic, there's really been a lot of emphasis on the administrative burden that is caused through navigating different complex services throughout the healthcare ecosystem, and technology adoption and the use of AI or RPA and other technologies to transform the work that's being done within organizations has never been a higher priority for organizations. So as we're looking at all this stuff that's going on, you have to think, you know, who's best positioned to lead us through the U.S. healthcare transformation that we're all going through. And truly that's on us. So we're the ones that are going to have to reevaluate the work that we do in a very meaningful way. And it really starts with thinking from an HR perspective, how do we position ourselves to best capture the opportunities, and how do we leverage technologies more effectively? So in this example, in the slide here that you all will have access to, what we've done is actually researched some job postings for current healthcare jobs against the job postings of FANG organizations. So that's Facebook, Amazon, Apple, Netflix, and Google. And really, I think what we see here is some of the more advanced technology companies on the right side of the screen, they've actually kind of redefined the roles. Although these roles are similar, the definitions of how the work is performed are vastly different. And I think our healthcare job postings will start to reflect sort of a different light. Instead of task management or routinized work and data extraction and logging into systems and taking on some of that tactical sort of executable routinized work, instead we'll have to be looking at how do we pull together teams to solve challenges? How do we look at creating different experiences? And I think that that's something that will be highlighted in some of the things that Cindy and her team are looking at as they're redefining the work within their organization. Now, to take a few minutes, I'm going to dive into just very broadly some of the things that are emerging in AI. This is a sort of term that I think is being very heavily utilized in the industry, but has a very nebulous definition and meaning for how we practically use it. So I'm not going to dive into and give you guys the 101 course on artificial intelligence. I don't think we have enough time to dive a little bit deeper into these advanced concepts, but really arm you with some basic fundamentals and then some materials that you can all leverage later on to become more educated. So again, we can take this technology from concept to actual implementation and utilization within your organization. So I think the first step is, defining artificial intelligence. At Olive, the way that we define it is sort of through the Turing methodology. So it's really, technology doing work in a way that is indistinguishable from their human counterpart. So it could be a lot of different technologies. It could be machine learning, it could be deep learning, it could be different robotic process automation, system actions. There's a lot of things that you can choreograph together, but really the end result that makes it AI in our eyes is this a machine doing work in a way that's indistinguishable from a human counterpart. Now, some more advanced technologies can take on more advanced capabilities, but that's really defining it. And look at the spectrum of different types of AI. There's narrow, broad, and general. So we're right in the middle today with broad AI. Narrow AI, this is replicating human tasks. So this is things like point solutions that you guys may be looking at. There could be a machine learning model that's looking at a lot of your accounts receivable to help stratify that and prioritize certain work. But when you get over to broad AI, this is a collection of a couple of those different point solutions or simple examples that could be used and stringing them together to actually complete an end-to-end process that actually opens up a lot more opportunity for you to apply this in different areas. So there's a lot of terms in these ecosystems, and really the idea here is to provide you just some tangible examples. So I mentioned, the Facebook, Amazon, Apple, Netflix, and Googles of the world. It seems to be synonymous that they're using a lot of these technologies to help scale their organizations differently, which is oftentimes why they're the household names. But I wanted to take a second to sort of deconstruct some of the things that Netflix might be doing that's creating a superior experience for using their systems, and then apply that to how you could think about that being applied within the revenue cycle with real examples of AI capabilities that folks are using today to start to create a similar experience for navigating healthcare, reducing administrative costs, and ultimately just optimizing your operations. So when we look at Netflix, the experience that we have there is great. They're creating content and they're distributing it so effectively. In healthcare, what we're doing is we're creating services, providing care, and we're distributing that to our community. So not too dissimilar with the ways that these businesses operate. But the way that Netflix goes about this, they're intuitively cataloging their content and curating things based on your activities. Helpful with the suggestions that they're making to you based on the habits of what you've watched before or what you've done previously. They're optimizing internally at their organization where they allocate their resources. So when they're seeing that there's a high influx of interest in this specific category or segment, that's what manages where they spend their money or where they put their time to say, you know what, we're going to need more cartoons that check these several boxes because that's where we're getting a lot of engagement today. So when we look at our portfolio and what content we're going to create, we're doing cartoons because the indicator of the habits of our network and our user base is telling us that's what we need to create. But then there's also technologies like cybernetics that are actually interacting with the human user to help them, encourage them to have broader use of the tool. So, you know, are you still watching? Constantly queuing up the next thing that you think that the algorithms think that you might want to watch based on your preferences and your habits. There's a huge opportunity to apply this to the delivery of care, and in our world, you know, with the revenue cycle and financial operations within a health system. So you can think of the same sort of walking through the value chain and how they interact and allocate resources, you know, with patient self-service and scheduling. How can we monitor and offer new and better ways for interaction with our staff using the habits of how they've interacted with us in the past? There are technologies and capabilities that we're working on with our health systems, and there's other systems out there to automate authorization, determination, and submission, so that way we can connect people to those resources more effectively. We can also use machine learning to look at our accounts receivable and optimize the resource allocation to say, you know, we should make sure that we work these accounts first prior to these accounts. I think historically there's, you know, looking at the days that these in as a historical measure for which ones we should be working first, or looking at net dollars, but there's some really advanced technologies that we can apply to say what gives us the best net return and who on our team is best suited to work that. So when you look at cybernetics, when you're identifying the opportunities within the accounts that you have, there's a huge opportunity to use advanced technologies to make sure you're getting the right information to the right people at the right time to more effectively manage your staff, but also manage the abundance of work that we all have in front of us. Within healthcare, there is definitely no shortage of work to be done, but definitely a challenge with getting it all done and doing it so in the most effective manner. So for these next couple slides, I'll kind of jump through these really quickly. It's really just to set you up with a framework to think about how we want to define this technology. It's not to be a complete lesson on what AI is, but at the top here, there's some conceptual frameworks that these technologies have started to adopt. And then beneath them, there's a number of different terms. And rather than going into each of these terms, I wanted to highlight with you all that there are a tremendous amount of opportunities to become more informed on the technology. This technology is here to stay. It's not going anywhere, and it can actually be an extremely powerful tool to leverage. So I encourage you all to, you know, leverage LinkedIn Learning. There's free courses on YouTube. HFMA has a great library of resources that can be leveraged. There's webinars, case studies, there's panels, there's all kinds of discussions that your peers are having, similar to the one we're about to jump into here on how they're using this technology or rethinking their work that you guys can all leverage today. So I wanted to actually, before we jump into Cindy's section, there's a lot of lessons learned. The bottom line is, I'll stop at the bottom here, is as you're approaching thinking about doing things differently, whether that's using technology or just changing the way work is being done within your organization, first you have to understand your problem. So, you know, what do you need, what do you want, and what's a win? But then to really make sure that it's meaningful, you need to understand your resources. How much is it worth? What's the total cost? Are you going to buy, build, or create this framework yourself? And then third, what are your options? Do you partner with someone? Do you have them internally? Do you want to acquire the resources internally? Those are some really of the fundamental concepts that I think we're going to dive into a little bit more. But I'd like to hand it over to Cindy. I know I covered a lot of stuff in a very short amount of time. But I wanted to pass it off to Sydney to walk you through the examples that her and her team have gone through building and implementing the future of work at Jefferson.
Well, thank you, Matt, and thank you, Oregon HFMA, for inviting me here. I only have a couple of slides, and they have a lot of words on them. Again, they're meant to be takeaways so that you have all the information you need moving forward. So I just want you to relax and listen to my story. You don't have to take any notes, and it'll all come together. But I'd first like to tell you a little bit about Jefferson Health. Can you go back a slide, Matt? Thanks. I'd like to tell you a little bit about Jefferson Health. It's really comprised of two separate entities, Thomas Jefferson University and Jefferson Health. It's 14 hospitals, 7 urgent care centers, and 25,000 professionals. And a fun fact is that 5 of the 7 physicians that are on staff for the Philadelphia Eagles NFL football team are Jefferson doctors. And we're pretty passionate fans out here, so we're pretty proud of that. Pre-COVID, we had a rather large telehealth business in place for years, and it was called Jeff Connect. And it was an app you downloaded onto your phone, and then if you had an emergent visit, you would simply launch the app, use your credit card, pay $45, and you'd be connected to an emergency room physician. And we encouraged our medical school students to use this, our employees to use this, and the community to use it. And we had several thousand visits a month for many years. When the surge for COVID came, our visits increased per month to about 26,000 on the average. And the highest month was 32,000. And we're still averaging in the 20,000 visits per month today. We've cared for more COVID patients than any other health system in the area, and only about 1% of our staff have contracted COVID, and that's true for the revenue cycle as well. I have over 700 folks in the revenue cycle, and about 7 of those employees tested positive. I actually came to Jefferson because they had a great reputation. I really am impressed by how simple and powerful they use words. Like, our mission is 3 words. We improve lives. And we have 3 core values. Put people first, be bold and think differently. And the last is just do the right thing. And I was asked to come to Jefferson by my former boss, Executive Vice President and CFO Pete DeAngelis, who was at Jefferson a few years, and lived through the mergers and acquisitions going from 3 to 14 hospital, $1.5 to $5 billion, and 3,000 students to 8,000 students. And by the way, we still have 8,000 students on our next class. Our students hasn't deteriorated as a result of COVID. But he asked me to come to figure out how to take all these different entities, these different divisions, and come up with an enterprise view for the revenue cycle, so that we could have a unified patient experience and really lower our cost per unit of service by streamlining our work. So at the time I joined Jefferson, they had 4 CBOs. They had 2 in Center City, Philadelphia, a physician and a hospital CBO. They had 1 in Abington, Pennsylvania, and 1 in Cherry Hill, New Jersey. And the scope of my work included from the charge capture. I was really mid-revenue cycle and back end, revenue integrity, CDI, coding, everything on both physician and hospital side through the end. And we had new headquarters down in Center City, Philadelphia, and my office was on the 30th floor of the new headquarters, and I had a beautiful view of the Philadelphia skyline. And little did I know, when I looked back on my calendar to see when was the first COVID meeting I attended, it was on Monday, March 9th at 5 p.m. It said, important COVID-19 meeting. And then 3 days later, on Thursday, March 12th, I attended a COVID fire drill planning meeting. And what that was our CIO wanted to send home 1,000 people as a test, to test our systems and how they could work remotely for 3 days. Little did I know when I left my office that Thursday that I wouldn't see it again, and I still haven't been back. So I worked home Friday. It was successful. We had a check-in call. Everybody was doing fine. Worked home Monday, and by the middle of Tuesday, Jefferson made an announcement that all eligible work-from-home employees were to report to home that week. So now we can fast forward to today. The reality is that, we're in a financial turnaround, not of our own doing. The losses as a result of COVID, coupled with 1,000% increases in need for PPE and the reduction in volume, have put all hospitals and health systems in this turnaround. And the government relief efforts, while we're grateful for them, they're only covering about 1/3 of our losses. I stated in my opening remarks the core values of Jefferson, the first one being put people first. And so far, Jefferson has not laid off or furloughed any university or health system employee, despite the bleak financial picture. Partnering closely with IT, we did successfully send over 600 revenue cycle people eligible to work from home, And the lucky thing was we had extra devices that we could deploy because we had been planning for an Epic go live in one of our divisions, so had purchased a lot of hardware and decided to use that to deploy for the work from home. I led a virtual town hall early on and told my team that the revenue cycle folks were essential workers and instrumental in ensuring the business continuity for Jefferson Health. And I don't think revenue cycle folks ever thought they were essential workers before. So this was a message we really wanted to reinforce. We were essential and we were providing the business continuity. I started business continuity huddles 3 times a week with the leaders, Monday, Wednesday, and Friday at 8 a.m. And in those huddles, we center ourselves at the beginning by having a reflection. And it simply was, a quote, a story, a poem about leadership, change, managing in difficult times, and teamwork. And it really set the tone for what were scary times and really kind of made us more of a team when we had those reflections as part of the meeting. And we were very successful in March. It was our highest cash month. We were very productive, but we quickly knew that the current state was unsustainable in the work from home that we had deployed. We recognized we needed a different management infrastructure, underlying technology, data, standard operating procedures, and lots of communication. So, I recognize people are our greatest asset and we need to set them up for success. But I also, our organization, like others, was in trouble and we needed to be bold, accelerate change to enable long-term sustainability. So, the shock of swiftly moving to work from home enabled us to unfreeze, and I think that's an important concept, unfreeze the way we've always done things and introduce kind of new thinking and some old tricks we know about. And this unfreezing period is a very short period of time, and so you need to act swiftly in turbulent times as people are more accepting of change at this time. And the change you introduce gives people something to latch onto and provide a sense of security. So we did a survey of our revenue cycle employees, and much to my surprise, we got a whopping 639 responses back to 16 questions in the survey. And the first couple of questions were just demographics. Are you management, non-management? What division are you from? What functional area do you work in? Coding, CDI, billing. And then the remaining questions were really two types of questions, asking about their work from home environment and checking in on their mental health and coping. And I think it's important to share some of our survey results with you so you have some context as to why we made certain decisions. So first of all, let me just tell you that 94%, and this was surprising to me because it was a very stressful time, that end of March, were either very satisfied or somewhat satisfied with their work from home situation. So we were surprised by that. The one mental health question we asked is, compared to the prior week, 66% of the folks felt more optimistic working from home, 32% felt the same, and only 2% felt pessimistic. That was a good sign for us. When asked their 2 biggest challenges being faced while working from home, we had 13 options that they could choose from and one open-end other. And it was interesting that the top 3 challenges in working from home, the number 1 answer was nothing. There is no challenge. The number 2 answer was general anxiety about the impact of COVID on my life. And the third top answer to our survey about challenges was social isolation. In other questions, 97% said they were receiving adequate communication and direction from leadership. And this was the most important question for me. 94% felt valued and that they were contributing to Jefferson's business continuity. 80% said they had the right equipment to work from home. So we knew we had a 20% gap. So we had to really go team by team to find out what the gap was, whether it was installing right fax, credit card processing machines, headsets, second monitors, whatever they needed to be effective to work from home. When asked if they'd like to continue to work from home, 98% said yes, permanently, and only 2% said no. And we decided that for employees that were eligible to work from home but didn't want to, we would create permanent workspace for them, whether it be an office or cube, so they could come to the office. We also made a conscious decision based on the survey results that we were going to announce permanent work from home to the larger workforce, and that, we were going to enable a fully distributed model virtual workforce for the eligible job types. So partnering with our facilities team, we are in the process of relinquishing most of our real estate, and in fact have ended already 2 leases. And giving up this space will save the organization millions of dollars. How we're planning to reorganize revenue cycle management support, we looked at other industries about different ways to manage. And that goes back to the second core value, be bold and think differently. We looked at NASA and mission control and how mission control supports the astronauts in space. And mission control's duty is to monitor the astronauts and ensure they have a safe, healthy, and successful mission. So that's in essence what we wanted to do with our virtual workforce. We wanted to monitor them and set them up for success. We needed, to enable virtual onboarding, training, continuous improvement, monitoring of metrics, productivity and quality, and provide feedback and coaching. We also thought about the airlines industry and looked at air traffic control. And their objective is to organize and expedite the flow of air traffic, prevent collisions, and provide information and other support. Well, that was what we wanted to do with our accounts receivable inventory. We wanted to move the inventory around, based on volume. So if our volumes fell during COVID, we wanted to redirect work, pull it in from our vendors, and give it to our employees to keep our employees busy. So this brought out the need for more timely reporting. Monthly reports we changed to weekly, so we had more timely data. And it also created a need for predictive modeling of staffing. If the volumes fall, what do we do with the inventory, and how do we manage it for the production areas of coding, cash posting, billing, and follow-up? We also thought artificial intelligence could help us manage the workforce. And in one of Matt's slides, when he was comparing to Netflix, it was about routing the right problem or denial, if you want to think of it that way, to the person who is most capable of handling that denial, who is the most successful in overturning that denial. So using intelligence to do things like that. Employees working from home permanently also wanted the option to come to work periodically. So we knew we had to set up a hoteling system. My performance excellence person partnered with IT to look at hoteling reservation systems. And in the end, we ended up deciding to use Outlook, just one of those tools right under our nose. You can reserve conference rooms today. Let's just add in a floor plan and certain offices and cubes for the revenue cycle people to make reservations in a hotel from. Then the next question became, well, how many cubes and offices do we need? And my performance excellence person said, well, and I hadn't heard this word since I think high school or college, we can run a Monte Carlo simulation to figure that out. So now we have a 90% confidence level in what areas, how many spaces we need for our facilities. The last thing we knew we needed was a formalized leadership structure. And, we have our person who was a black belt, my performance person, and he was helping us design standard work, virtual huddles, Gemba walks, all the things performance excellence people wanted us to adopt over the years. but it was just hard to do when we were used to doing things the way we always did. So now was the time to measure, implement these procedures, because what gets measured is what gets done. So with our new planned way of managing people through mission control, AR inventory through traffic control, we're creating new and different roles. Mission control folks have adult learning skills, coaching skills. Air traffic control has analytics and predictive modeling skills. And finally, we have 4 different work from home technology toolkits that are standardized too, so we know our cost, and based on what job they get that tool set. Transparency and a future state that seems less scary to employees has allowed them to determine part of their future, makes them more likely to adopt the changes that we're introducing, because they played a role in helping us design those changes. So if I made it sound easy and clean, it's not. We've been building the plane while we're flying it. About a month ago, I've noticed on people's faces in Zoom the change fatigue that they're experiencing. So getting back to what Matt said, we made some changes. Every hour meeting is now 50 minutes. Every half-hour meeting is now 25 minutes, so people get a break from their screens. And then we also are encouraging PTO so people can tap out. COVID has burnt people out, the economy, everything that's going on. So we can go to the next screen. We made a lot of important decisions during these uncertain times. And since I came from Catholic healthcare, I wanted to leave you with this Robert Greenleaf quote on the dilemma of the decision maker, and how you have to make decisions without 100% of the information. Just pull the Band-Aid off. And then finally, if you want to go the next, I just want to end with Jefferson's third core value, which is do the right thing. And I like how Nelson Mandela said, it always seems impossible until it's done. I want to thank you for your attention. I apologize for talking fast, but I just wanted to kind of give you a flavor of our full story. So thank you.
Yeah, I appreciate everyone's time. I know that we went through our material pretty quickly, and wanted to open it up to any questions that you all might have. Make sure that we address anything in the next couple of minutes. Cynthia, I have a question. This one says, what's on your roadmap for the next 5 years? What does a win look like for Jefferson Health with the emerging technology space and the changes to the workforce?
I would say our roadmap includes artificial intelligence, optimizing Epic, predictive analytics, automating productivity and quality reporting, delivering virtual training and onboarding, I mentioned that, and sustainable work from home. And how we'll know we made it work is if we're able to turn around to profitability within 2 years.
Great, thank you. And we got one more. I think we've got time for one more, and then we can kind of do some closing remarks. What strategies have you implemented to combat social isolation?
Yeah, that's why we decided to make a hoteling option available. And for those people who didn't want to work from home, a permanent office location. Also, it's cameras on, and that's a safety issue. The reason we want cameras on is we want to be sure everyone is okay. So also, game playing. We play bingo, like in a meeting, if we have bingo cards for some meetings. If a dog barks, that comes up on your bingo card. And I've been waiting for my dog to bark through this entire presentation. If somebody says, unmute me, can you unmute yourself? That's on the bingo card. So just having kind of fun with it too, And it looks like from your video, Oregon has a lot of fun, so.
Yeah, I can definitely agree with that. I think one thing that we've done at Olive as a way to sort of connect people, it's you don't get a lot of the water cooler talk. We actually implemented a technology. It's called Donut, and it attaches to our enterprise chat tool. And anyone that's subscribed to a specific channel, it automatically matches you with someone across the organization to have coffee with. I think it's been a really interesting way to meet people that you wouldn't normally bump elbows with, and kind of creates a virtual water cooler or coffee machine conversation, which has been an interesting way to use technology to kind of force the interactions that a lot of us used to use as a sort of taken for granted in the environment that we're in. So I know we're up on time. Just wanted to say thanks again, everyone, for the material, for allowing us to go through our material. Hopefully this was helpful in providing some perspective and education materials that are available for you all to sort of help transform the operations within your organizations, and also use the example that Cindy and her team have been forging throughout their shift to the future of work within Jefferson as an example or a guiding light. If at any point you guys have any questions for us, feel free to reach out to us directly. But thanks again for your time.
Awesome. Great job, guys. Thank you.